Chlamydia is a common sexually transmitted disease caused by a specific strain of bacteria known as Chlamydia trachomatis. It can cause permanent damage to a woman's reproductive system. Even though symptoms of chlamydia are usually mild or absent, it may cause serious complications, including infertility. In 2020, a total of 1,579,885 cases of Chlamydia trachomatis infection were reported to the CDC, making it the most common notifiable sexually transmitted infection in the United States for that year. Chlamydia can be transmitted during vaginal, anal, or oral sexual activities. Chlamydia can also be passed from an infected mother to her baby during vaginal childbirth. Chlamydia is known as a silent disease because about 3/4 of infected women and about half of infected men have no symptoms. If symptoms do occur, they usually appear within 1 to 3 weeks after exposure. In women, the bacteria initially infect the cervix and the urethra. Women who have symptoms might have an abnormal vaginal discharge or a burning sensation when urinating. When the infection spreads from the cervix to the fallopian tubes, some women still have no signs or symptoms. Others have lower abdominal pain, low back pain, nausea, fever, pain during intercourse, or bleeding between menstrual periods. Chlamydial infection of the cervix can spread to the rectum. Men with signs or symptoms might have a discharge from their penis or a burning sensation when urinating. Men might also have burning and itching around the opening of the penis. Pain and swelling in the testicles are uncommon. Men or women who have receptive anal intercourse may acquire chlamydial infection in the rectum, which can cause rectal pain, discharge, or bleeding. If untreated, chlamydial infections can progress to serious reproductive and other health problems with both short-term and long-term consequences. In women, untreated infection can spread into the uterus or fallopian tubes and cause pelvic inflammatory disease, PID. This happens in up to 40% of women with untreated chlamydia. PID can cause permanent damage to the fallopian tubes, uterus, and surrounding tissues. The damage can lead to chronic pelvic pain, infertility, and potentially fatal ectopic pregnancy. Women infected with chlamydia are up to 5 times more likely to become infected with HIV if exposed. Complications among men are rare. Infection sometimes spreads to the epididymis, the tube that carries sperm from the testis, causing pain, fever, and, rarely, sterility. Rarely, genital chlamydial infection can cause arthritis that can be accompanied by skin lesions and inflammation of the eye and urethra, Reiter's syndrome. In pregnant women, there is some evidence that untreated chlamydial infections can lead to premature delivery. Babies who are born to infected mothers can get chlamydial infections in their eyes and respiratory tracts. Chlamydia is a leading cause of early infant pneumonia and conjunctivitis, pink eye in newborns. Chlamydia can be easily treated and cured with antibiotics. A single dose of azithromycin or a week of doxycycline, twice daily, are the most commonly used treatments. HIV-positive persons with chlamydia should receive the same treatment as those who are HIV-negative. The surest way to avoid transmission of STDs is to abstain from sexual contact, or to be in a long-term mutual monogamous relationship with a partner who has been tested and is known to be uninfected. Latex male condoms, when used consistently and correctly, can reduce the risk of transmission of chlamydia. Yearly chlamydia testing of all sexually active women is recommended.